Good evening, Dr. Ahmed.
Good evening, Dr. Iskan.
Thank you for hosting and helping us today to hold this coffee chat session. It's an honor to us to be with you today.
It is my pleasure to be with you today and to speak in a subject which is one of the most important subjects in the medicine today.
Dr. Ahmed, me and all your audience is interested to know more about your experience and history. So can you please share with us this history and experience?
Starting, I have graduated from the Faculty of Medicine on December 79. I took a master degree in rheumatology in 84. After that, I took the MD 1991, MD in rheumatology and rehabilitation. I was working in the Sports Medicine Center, which is related to the Ministry of Youth, which is responsible for treating all the sportsmen and especially the national teams of Egypt. So we have faced many cases of knee osteoarthritis, and all the athletes are suffering from this arthritis. Together with my clinic and with my private patients, we faced and we looked for many cases for osteoarthritis.
Dr. Ahmed, great to hear from you about that. From my experience, Dr. Ahmed, I know that knee osteoarthritis is a very common disease, especially in your clinic. You face it, we can say, every day. So please, can you tell us about the osteoarthritis cases which you face it every day, every week in your clinic, and what are the main common symptoms that they are suffering from in your clinic?
Osteoarthritis is one of the disabling diseases. It was disabling because of the pain and the sense of discomfort during the walking, during climbing stairs, like that. So it is considered one of the disabling disease. We faced in our clinic almost about 10 to 15 cases per week. Unfortunately, most of them between 20 and 30 years. Some cases are over 40 years or 50 years old, but these are chronic cases. And here in Egypt, maybe we have a problem that the patient doesn't seek for medical advice except after late stages. And also always we are recommending to not to be like that. Osteoarthritis is rheumatic inflammation in the cartilaginous part and osseous part of the joint, especially the knee joint. And it affects the ligaments also, because especially the medial collateral ligament affects the viscous secretion in inside the knee. That's why it causes it. They are considered some sort of a pitting inflammatory agent. So we recommend always to be early treated.
Early treatment.
Yeah, early treatment, yes.
Especially here in Egypt, Dr. Ahmed, from my experience with you especially, you told me a lot that the Egyptian patients have many risk factors and many diseases also related to osteoarthritis. Some patients are obese, some patients...
Of course, we have here in Egypt, diabetes is one of the epidemic diseases, obesity, and this is also one of the most important causes and precipitating factors for the osteoarthritis. And this is from epidemics in Egypt.
Yeah. Sure, Dr. Ahmed. From your talk, it is a very common disease and very dangerous disease for your patient. So let's talk deeper about we can say the medication and medical protocol you use with this patient, osteoarthritis patient.
First of all, you must have a good diagnosis for the case and the proper diagnosis. And we always depend upon the most intelligent method or tool, which is the WOMAC test. After that, you always need to have some X-ray, sometimes CT scan, MRI, according to the condition. You must evaluate the patient from the weight, his weight, either he has another chronic diseases or not. All of this, you are evaluating the patient to determine which way or what is the protocol of treatment you will follow from the start. If he is obese, you must advise him to go to the nutritionist to start for weight reduction, and also to support his muscle, and by strengthening exercises, maybe in the physiotherapy or maybe in a gym, because weak muscles put more stress and more burden on the joints.
Yeah.
After that, you can use some non-steroidal medications as like analgesics, non-steroidals, something like glucosamine. But in most cases, because of the patient always coming in it, most cases this is not effective so much, and the success rate is not as we are expected. That's why we sometimes are obliged to be directed to the injection, intra-articular injection. Intra-articular injection, we are using following the rule of viscosupplementation, which means that we are increasing the viscosity inside the knee joint, which lubricates the joint and will prevent any irritation and any friction between the bones and each other, and this will decrease the inflammatory response and the inflammatory conditions.
Okay, Dr. Ahmed, I'm happy that we are reaching this part of speech about the viscosupplementation. So let's talk more about the viscosupplementation. What is the active ingredient do you prefer in the viscosupplementation? What is the main feature you should have in the product you recommend to your patient?
The most better or the best one is the hyaluronic acid, and if the hyaluronic acid is higher in molecular weight, this will be more better than the low molecular weight. For me, I prefer always the dose of 90 milligram per injection, because it gives us a long duration for healing and long duration of relief of symptoms. Injection is always not preferred by patients.
Yeah.
So when you can decrease the number of injections, it will be more better. And this we are achieving from the high molecular weight hyaluronic acid.
Yeah, high molecular weight, high viscosity.
Viscosity, of course, yes.
A high concentration of the product is the main feature we can say that is the main feature that you are looking for in your product.
Yeah, of course, yes.
Yeah. Dr. Ahmed, according to these features that you talk about, the 90 milligram concentration, the high viscosity, high molecular weight, let's talk about a good feature also. I want to share this talk with you, cross-linked. If the cross-linked product is important for you, cross-linked feature is important for you?
Yeah, of course, it's one of the most important features, because it gives me the chance to elongate the duration between two injections.
Yeah.
It can reach 6 or 7 months, sometimes in some cases we can reach 9 months.
Okay.
And this is more beneficial for the patient.
Okay, Dr. Ahmed, let's talk about our star today, Optivisc 90 milligram. From your experience with you, Dr. Ahmed, you used Optivisc 90 milligram for 1 year for your patient. So let's talk about the feature you found in 90 milligram, not found in other products in Egypt, and what is we can say the effect, the good effect of an Optivisc 90 milligram for your cases.
First of all, I want to thank the company for introducing this good medication in Egypt, which is the Optivisc 90 milligram from Biotech. It has a very good features like the cross-linked features, like the high viscosity, which one of the most important features for us in cases of osteoarthritis, especially in more obese patients. Also for the highest dose, because it is one of the highest dose in Egypt. So we are always now used it since about 1 month, 1 year. I have a very good effect from the patients and very good feedback from patients. But if it is also combined with weight reduction, it gives a marvelous effect. So I always prefer to use this Optivisc 90 mg from Biotech for all of these features.
Okay, thank you. It's honor to us, Dr. Ahmed, to hear from you about the Optivisc 90 mg. I always happy to see the result for your patient about the 90 mg Optivisc.